World over, health, no doubt, is said to be the most important need of man. It is believed that better health is central to human happiness and well-being. Besides the important contributions to economic progress, healthy populations live longer and are more productive. This explains why responsible governments strive to provide improved health facilities for its people. Nigeria, as a developing country, is still grappling with its own share of the global health challenge, in that the provision of healthcare services in the country have been and are still very poor. Despite Nigeria's strategic position in Africa, the nation's health sector is replete with outdated facilities and shortage of personnel. Sizable portions of available medical equipment are obsolete and grossly inadequate, especially in rural areas where more than 65% of the people live. The desire to reverse the ugly trend and prevent the avoidable deaths of mothers, infants and many children in Delta State has propelled the Governor Ifeanyi Okowa-led administration to do things differently. The administration, despite the huge downturn, began the renovation of various government-owned hospitals across the length and breadth of the state. This move, according to the governor, is to ensure that health facilities are themselves healthy for human habitation.
The bedrock of the prosperity for all Deltans is health prosperity for all Deltans. That's the bottom line, first and foremost. And His Excellency believes that every Deltan should be healthy enough to be able to produce wealth for himself.
Given the physical space within which we are operating, it is a priority sector for us. On the Ministry of Health and PHCs, we have 6.6 billion provided in that direction. So if you look at the percentage of health alone to our budget, it's significant. So it's also a priority area in line with our medium-term development plan.
The administration, as a matter of policy, renovated and upgraded the infrastructure in both major and secondary health facilities across the 3 senatorial districts of the state. The statewide upgrade of health facilities brought about the renovation of the General Hospital Patani in Patani local government area. Here, the government also rehabilitated the water supply scheme to prevent scarcity of potable water. The pediatric ward in the Patani General Hospital is a sight to behold, as it stands out in that area. These renovations of the hospital, in addition to the re-equipping of the facility and provision of more drugs, have helped to enhance promptness in responding to the teeming patients that visit the hospital.
If you had been to this hospital before now, you would see the difference. He has performed so wonderful. He did a lot to Patani. All our accommodation, our houses, equipment, everything were properly supplied. He's a wonderful governor.
The hospital wasn't in a good shape, but now, as you can see, this is a kind of an ultra-modern hospital. It will go a long way to provide good health care to Patani and other villages.
Women, they born free, they go back. They collect money, some kind of treatment like that, now for free.
They have touched not only Patani local government, the neighboring local government and our sister state, Bayelsa State.
This smart vision of Governor Ifeanyi Okowa has led to the rebuilding and upgrade of the cottage hospital at Abavo in Eka South local government area to the standard of a general hospital with state-of-the-art equipment.
During your electoral campaign here in Abavo, you clearly underlined your awareness of the needs of Abavo people. By the grace of God Almighty, that electoral campaign pronouncement has been fulfilled today. And Abavo Kingdom now has a standard hospital.
Glory of God, I wish to formally commission the General Hospital as well as Abavo. Jesus.
The specialist hospital at Ogara in Ethiopia West local government area has not escaped the eagle eyes of the smart-thinking governor. The Ogara Teaching Hospital, an arm of the Delta State University, Abraka, is now famous for the provision of high-level Medicare and is now more of a destination for medical tourism.
This is the only teaching hospital in Delta State. All of this has been possible because we have a government that is fully engaged in ensuring that we deliver what is the best health care for our people in Delta.
We are grateful to the assistance that the Governor Okowa gave to us some time ago, and we really want to plead that we continue to get such support, because actually this kind of equipment cannot be maintained by the revenue that you actually generate from the patients that come. It's a very sophisticated machine.
This kind of waste is not something that you just throw away like that. You must, even if the time they were giving it out to a contractor, I think there would have been a process to follow it through to where they are burning them. It's cost effective, there's value addition, and now we are 100% sure of our disposal mechanism. Yes.
We would like to appreciate the Delta State government for their kindness in bringing, first of all, a teaching hospital to Delta State and precisely to Ogara. We have the opportunity to get access to world-class facilities in our hospital, which in most centers you can't get it, like the issue of the 1.5 Tesla magnetic resonance imaging.
I had an accident many years ago, so I've gone to several places to take treatment, but immediately I came here, what I saw here is encouraging. That's why I continue to come here to see the orthopedic doctor.
Governor Ifeanyi Okowa's signature projects in the health sector are also visible at the zonal hospitals in Warri, Bomodi, Kwale and Ogwashuku. Facilities at these centers are receiving due attention, as Governor Okowa tends to have devised a development mechanism that obviously defies the daunting challenge of terrain and topography.
If it were in another hospital, we would have paid heavily, but thank God we are doing well. Thank God for Governor. If not, it would have been something else. Thank God for him, he's doing well. We appreciate him for that.
Me and my baby come here for treatment, and the attention they gave to us here was okay. The medicine, every other thing, drip, it was free.
From the time of registration till delivery is free. They don't pay for anything. Lab investigations are free. Drugs are given to them free. In fact, everything is free, and it's been interesting. And because of this free healthcare, a lot of women who used to go outside or go to traditional birth attendant, they now attend the hospital because it is free.
Before the intervention, the building was almost completely collapsed. It was extremely difficult for patients to sit at the waiting bay to be seen by the doctors and all that. But now you've gone into the building and you can see that the building is standing very firmly. And of course, with the intervention, dialysis is being done for all patients who require dialysis.
At the Government Cottage Hospital, Ogriagbene and Bomodi General Hospital, for example, the theatre has received a facelift with the installation of the state-of-the-art sterilizing medical equipment. The present state of the facility has restored the people's hope, even as it has engendered accessibility of rural dwellers to improved health facility.
In Bomodi is a renovation going on while the facility is still in use. You can't actually appreciate the entire work being done until it's fully done. Now the theatre has been completed, and we're in the process of re-equipping it. We want to remove the obsolete equipments in the theatre and replace them with new ones.
It is for the purpose of uplifting the free maternal program that I am deployed here, to not only to help the place but also to help to optimize services in terms of maternal and child health care services. So the people have been responding well.
I delivered here 2016. So when I delivered, they did not collect anything from me. I deliver and I go home freely. I did not pay them 1 naira. And the drugs they are giving to us, they are giving us free drugs. And when we come here, they'll take care of us and we'll go without paying any money.
Beyond the rebuilding, re-equipping and training of health personnel at the Delta State College of Health, Ufoma, learning has never been so much fun for students as they are now exposed to very rich educational cultural heritage while studying in a more conducive learning environment, iced with seasoned lecturers which abound in the institution. Today, the school has become a one-stop shop for an all-round human healthcare study. When the Smart Delta Media crew got to the nutrition and dietitian department, they couldn't resist the sumptuous Urobo delicacy of Usi and Owerri.
It looks very delicious. Let me have a taste. Clap yourself, clap yourself.
The burning desire to tackle the infrastructure deficit at the health training centers also brought about the building of no fewer than 250-bed hostels for nurses at the state schools of nursing. This different noble intervention of the Okowa-led administration has helped to facilitate the full accreditation of the State School of Nursing Abo by the Nursing and Midwifery Council in September 2017. Within the last 3 years, the administration has registered 10 new nursing and maternity homes. And to ensure standardization of healthcare practice, 35 existing nursing and maternity homes have undergone inspection to ensure the adoption of standard practice. Added to these is the rebuilding and furnishing of the administrative blocks and access roads in the 3 state schools of nursing at Abo, Eku and Warri, as well as the Asaba School of Midwifery.
Training does not end here. The students go to the clinic area to practice, and then they complement the staff. Their presence as skilled midwives will help to tame down the high mortality rate that is experienced all over the country. They are not just being trained for only Delta alone, but their contribution worldwide will help to improve human health and general productivity.
The Central Hospital Asaba, which has been under construction since 2006, is now receiving fast-track attention. At different times, Governor Ifeanyi Okowa undertook project inspection tour with a view to putting the contractors on their toes.
Yeah, so the Central Hospital, yes, is coming up to shape, but there's still a lot to be done. A lot to be done in terms of physical work, and then thereafter you're going into issues of equipment. Obviously, it is a priority, because if not for the Federal Medical Center, I'm sure that a lot of our people will run into problems. Because outside the Federal Medical Center, the only public hospital you have is the Okowa Hospital, which is a very small hospital, and Asaba is expanding by the day. So apparently we need that to work. We need it to work, and we'll do everything within our reach to ensure that we stay on course.
Though the Federal Medical Center Asaba is an institution of the federal government, Governor Ifeanyi Okowa has at different times intervened to uplift the facility.
This is what we got. This is a digital mammography machine for breast cancer screening. It was part of the digitization program of His Excellency. With this now, we can screen patients for breast cancer, and then also we can manage them in the hospital here.
The construction of medical wards and internal roads at the center has raised the aesthetics value of the institution.
Welcome to Delta State, the big heart. Come, live, invest, and explore the potentials of our Delta.
Aside the huge resources deployed to revamp, rebuild, renovate, upgrade, and equip health facilities across the 3 senatorial districts in the state, what has become the defining philosophy of the Okowa administration in the health sector is the introduction of the contributory health insurance scheme.
Our scheme is made up of different plans. One of the plans is the vulnerable group, the basic health plan for the vulnerable group. The vulnerable people are people who are having difficulty in making money, having difficulty in sustaining themselves. And the governor has decided to ameliorate this problem by providing certain care.
The mandate of the scheme
is to ensure access to quality health care for all residents of Delta State, irrespective of their socioeconomic status in the society. So that summarizes the entire gamut of what the Commission does in such a way that they're able to access care without that access to care affecting their financial status.
The social welfare scheme for widows is a continuation of all the social benefits the government of Dr. Senator Okowa has bestowed on people and Oshimile South in particular.
Selected widows across the state will be enrolled into the contributory health scheme, where they will be given medical attention because of the situation they find themselves. That medical attention is going to be paid for by His Excellency Senator Dr. Okowa.
Enrollees of the health insurance are saved the trauma associated with out-of-pocket expenses for urgent Medicare.
I'm happy about it. I won't buy drugs again. If I want to go, I go with pride. Protect me, I go with buy drugs. I'm happy.
I pray that God will let them continue the way they are doing it now, because the free drugs, the free treatment they are giving to us, we are very glad and happy about it.
Anytime I come there, they attend to me very well. Check my baby very well, give me good results. All those things, maybe if I'm having any pains or whatever, when I come, they will take care of me. Check me very well. They won't take anything from me. I will say thank you to the government. I want to say a big thank you to Dr. Okowa for his support, but it is not easy. So we ask that God should give him more strength, God should protect him, should give him more vision, that whatsoever he has been doing to assist our women and the under 0 to 5 years old, that God will replace his pocket in Jesus' name.
Mindful of the distress in the national economy, the Okowa-led administration undertook the burden of paying the health insurance premium of children under 5 years and pregnant women. This gesture was recently extended to about 5,400 widows across the 25 local government areas of the state. The Director General of the State Contributory Health Insurance Commission, Dr. Ben Nkechika, alongside staff of the Commission, regularly visits selected health facilities to ensure that neither the state nor the enrollees are shortchanged. One other agency that has helped to extend quality health care to remote communities in the state is the Delta State Primary Healthcare Development Agency. Dr. Isioma Okowa, the chairman of the agency, is so passionate about taking health care to where it is most needed, the grassroots.
Good morning. Good morning. How are you, Dr. Okowa?
She has left no stone unturned to see to the success of these projects that are so dear to the governor's heart. The agency's core mandate is immunization and other primary health care needs.
We're here on an integrated supportive supervision of all the primary healthcare centers in Bomadi area, and also to assess the needs of the people in the primary healthcare centers in Bomadi. And this is basically, we're assessing the physical infrastructure, also looking at the personnel, the human resources, and also looking at the quality of primary health services that they deliver to the grassroots. And where there are any gaps, we go ahead and fill those gaps and actually bring the health personnel up to speed with what they should actually be doing.
As part of measures to promote a much more healthy, upwardly mobile youth population that abound in the state, the administration, in collaboration with the National Drug Law Enforcement Agency (NDLEA), has inaugurated the State Drug Control Committee with mandate to curtail the use of illicit drugs and narcotics by the youths of the state.
From about 300 secondary schools across the state. These teachers are to be trained, are to be sensitized on the nature of this drug abuse, the adverse consequences on the youths especially, and they'll be encouraged to go back to the schools and set up clubs against misuse of drugs.
Holding health matters professionally to his heart, Governor Ifeanyi Okowa has ensured that all counterpart and contributory funds for health projects in the state are released and paid as at when due. This has made for the effective functioning of the State Drug Revolving Fund, as well as the full compliance and up-to-date immunization of children in the state against childhood diseases.
The success story cannot be complete without mentioning the support of the present governor, Senator Dr. Ifeanyi Okowa. When he came on board, he approved the purchase of distribution vehicles and monitoring vehicles for this establishment. All the drugs that come into the Let Us Take Drug Revolving Fund, apart from the drugs being certified by NAFDAC, we do an extra verification.
The Standing Committee on the National Action on HIV and AIDS has kept pace with creating awareness as well as handling and reducing incidents of infection.
We have the tuberculosis unit in the hospital, which we call the chest ward, and we have the HIV unit, which we call the heart-to-heart unit. These two departments is also receiving free health services. They don't pay for their treatment, and it's courtesy of Delta State government.
Government's efforts at ensuring adequate staffing as well as commensurate and competitive welfare package for the teeming medical staff in the State Health Service cannot be overlooked. Apart from the engagement of qualified health personnel ranging from medical doctors, pharmacists, physiologists, nurses and other support and ancillary staff, the State Hospitals Management Board has recruited 150 volunteer nurses and 50 health assistants to enhance the care of patients. As part of measures to take the state's healthcare a step higher, the state government has entered into partnerships with several healthcare providers and institutions. In this regard, the government has signed Memorandum of Understanding with the Novena University Ogume, Interact Global Health Solutions, the Benson Idahosa University, and the Save 1 Million Lives program for the purpose of staff retraining, digitization of health data, and effectiveness of immunization programs.
Well, there are so many things I've learned coming here today. I need to get back and step down the training to those of my colleagues that are not here so that more lives can be saved.
This training is a life-saving training. It has helped us to improve on how to care for emergencies.
Such partnership was also apparent at the groundbreaking ceremony for the headquarters of the Asaba branch of the National Medical Association (NMA). These partnerships have helped the administration to strengthen the health system and enhance healthcare delivery in the state.
Come, live, invest, and experience the possibilities in our Delta.
Another defining aspect of the administration's healthcare intervention are the activities of the O5 initiative, a pet project of the wife of the state governor, Dame Edith Okowa. Through this pet project, the state's First Lady has been able to mitigate the sufferings of anemic persons in the state. The O5 initiative has set up and fully equipped 11 sickle cell clinics in Ughelli, Ureokwe, Eku, Ole, Batani, Abo, Kwale, Sapele, Utu Jeremy, Koko and Iseluku. The sickle cell clinics set up in the hospitals in these communities have become safety valves in the handling of critical cases of sickle cell anemia in the state. The sincerity of purpose and the credibility that has attended the government's efforts at improving healthcare delivery in the state has caught the fancy of some well-meaning individuals. One of such is the Martha Charity Foundation. The foundation donated several container loads of medical equipment to the government.
I wish to formally commission this equipment donated to the Delta State government by the Martha Charity Foundation. And I wish to thank God for this day, and it is my prayer that this equipment and devices will be put into the best use of our various healthcare centers for the benefit of all Deltans and non-Deltans that live in Delta State.
Flowing along the same line of trust in the government, Mr. Aliu Moses, Managing Director of Stepco Nigeria Limited, on the 27th of March 2017, donated medical waste incinerator to the state government.
We are here today with my team to support the good work of His Excellency towards making sure that quality health is given to the good people of Delta State.
Governor Ifeanyi Okowa's smart initiatives, no doubt, is making a whole lot of difference in the health sector.
You better run, come to Delta State. Come and see the good things where Okowa they do. You better run, come to Delta State. Come and see the good things where Okowa they do. I see your job and work creation in Delta, make the youth say them highlight. Okowa, I see good roads everywhere in Delta, make the people say them cola.